is no way to live, and taking medication or having surgery is not something most of us want to do. Well, what if you could put it off indefinitely? What if all you had to do to stop the pain is just grab a straw and breathe? Dr. Amy Novotny, she is founder of the Paber Institute, and with her is client, Dr. Muriel McClellan. She's going to tell us how she's feeling better by this amazing technique that, Dr. Amy, you created this technique. First of all, explain to us, what is Paber? What does that stand for?
Thank you for having me today.
You're welcome.
And Paber stands for Pain Awareness Breathing Relief. We are getting people from pain to relief using body positional awareness training and breathing techniques.
That is amazing, and I cannot wait. I want our viewers to hear your story in a moment, Dr. Muriel, but first of all, Amy, this is something that you created. You are a doctor of physical therapy, correct?
That's correct, yes.
So you took a combination of all of these different things, I guess, that you've learned throughout your career and came up with this technique. Who benefits from this?
So many people benefit. Anyone who's in pain, chronic pain, stress, anxiety, sleep disorders, people who are going to have surgeries but don't really need to have those surgeries and don't know that they don't need to have them.
But Amy, how does just breathing make a difference?
Well, it affects our nervous system. So we are constantly in tension, and that tension in our nervous system will cause our muscles to pull abnormally on our bones and joints. And what we can do is, if we learn how to calm down that part of our nervous system, to learn how to relax those muscles, the bones and joints can reposition, our body can go back to neutral, and it frees up the space that where we were having impingement, and you get freedom, relief, pain relief, so many other things.
It makes perfect sense. Okay, can we do a demonstration
Absolutely.
real quick? Okay, so I have a straw. Okay, come on over here and tell me what I need to do.
Okay, so the first thing I tell people is to let the belly go. Let your gut hang
I
out.
work all day keeping it in, but all right.
I know, but we have to let that gut go. And we're gonna have you do 4 little steps. We're gonna breathe in through the nose without lifting up the chest or head. Pause a second. Now blow out through the straw, letting your chest drop down, belly come out. Now pause 3 seconds. And then we'll breathe in gently through the nose. Good. Pause. Blow out through the straw. Let your chest drop down, belly come out, and pause 3 seconds. Those 4 steps are the basic 4 steps to getting you to calm your nervous system down.
What is amazing, she instructed me right before this segment, so I had a little bit of understanding here. You can feel what your body is doing. Muriel, you went through Amy's program, and you were on the books to have knee replacement surgery.
That's right. 3 years ago, I was scheduled to have my knee replaced, and Amy said, you should try this first. So I went 1 week for 5 days, and then I went the next week for 3 days, and I felt a little better right away. And then by the second week, I called up the surgeon and canceled the appointment. I'd had steroid injections, I'd had prescription strength anti-inflammatory. In the 3 years, I don't take anti-inflammatory. I feel great.
And now you're hiking and photography and going to exotic places. You're heading off to Alaska soon to go.
Yes, right.
No surgery, no more medication, no more injections.
Medication, no surgery planned.
So Amy, a lot of people are sitting at home, everybody's in pain, right?
Right.
How do you decide? I mean, it's a treatment session. How often should we come? When will we see relief?
So I treat people for an hour to an hour and a half for their first visit, and I like to see them once a week initially.
Okay.
They can feel relief in that first session. I expect them to feel relief within 5 to 10 minutes of me working with them and showing them. And then they just have to do a little bit more at home to help keep that relief.
It's all about in the technique. And here's your tool, a straw. Ladies, thank you so much. Amy, thank you so much for sharing that.
Thank you for having us.
Of course, we have Amy's information on our website, sonoranliving.com. I know it's a hard concept to wrap your head around, right? So I decided to give Amy a call because I have a lot of inflammation in my esophagus, and my throat would get super tight. And her instruction releases everything. And it just doesn't matter where the pain is, knee, neck, whatever. It was amazing. Susie, we walk around like this all day, and you just learn to breathe and you use these exercises, and it calms everything down and opens everything up, and blood starts to flow,
The
and
beautiful
wonderful things
thing,
happen.
the body in most cases can naturally heal itself.
Right.
And breathing is a major part of that. So very cool technique. Jump on our website to learn more, and maybe go make an appointment with her, because if it can keep you from surgery, that is the key for so many people.
Absolutely.
We'll see you back here tomorrow at 9. Have a wonderful